Yes, good evening. We're here at City Hall where the GHA Public Meeting has just wrapped up. A very big crowd of around 60 people have attended, and there's been talks from the Minister for Health and Care, Gemma Arias-Vasquez, Dr. Roger Moore on the catheterization lab, Dr. Helen Carter on the cervical screening program and other screening programs, and the Director General, Kevin McGee, who actually joins me now. Mr. McGee, thank you for joining us. So first of all, could you just tell us the value of these types of public meetings?
So we've had over 60 people here this evening, as you've said, and I think it's really important that we engage with the public. We can pass information, and I think the presentations on the cath lab and the services that we can provide, and particularly in terms of the screening information and the screening programs, are so valuable for the public to hear. But it's also really important that we can engage with the public outside of the hospital setting, which can on occasions be intimidating.
So interestingly, although those questions and answers are very important, there weren't many questions at all this evening. A couple of points for feedback, but despite a big audience, really no questions at all. What do you take from that?
I'm really surprised at that. I hope it's because the presentations were so informative that we were able to answer the questions that people would have. But you could have got that on another night and it could have been exactly the same in terms of the presentations, and we probably could have got dozens of questions. So probably not taking too much from it, but it was great that the turnout was as large as it was.
We did hear some of those presentations on the catheterization lab, on the screening programs. Let's start with the cath lab. Some really interesting figures on heart attacks even there this week alone. Could you just explain some of what it's been doing and how this is changing treating these things in Gibraltar?
Yeah, so previously anybody who had a suspected heart attack in Gibraltar would have had to been transferred primarily to Spain for their treatment, and that could have taken 2, 3, 4 hours, as we heard from Dr. Moore. And with a heart attack, time is absolutely the essence, and what we can have now from somebody perhaps coming through A&E and been seeing in A&E, it takes 1.5 minutes or just a little bit over to transfer to the cath lab, where they can have state-of-the-art treatment for the likes of heart attacks or suspected heart attacks, and that is literally life-saving time. So we are really, really pleased that with the facility, the fact that we've got a state-of-the-art cath lab within Gibraltar, and the fact that we can save lives accordingly. And if you look at the data, prevalence of heart attacks is quite high in Gibraltar. That was one of the statistics that Dr. Moore showed. So more than anywhere else, I think having a local facility in Gibraltar is so important because of the prevalence of heart attacks of our local communities.
Dr. Moore highlighted that there were 5 heart attacks seen this week alone at the cath lab. Is that a high number for a week alone?
It is a high number, but of course, given the nature of these type of presentations, you just don't know. You could go for a week without any presentations, or you could have a week such as this, where we've had 5 in a few days. But that shows the value of the local facilities, because you just can't plan. You don't know when somebody's going to have a heart attack. You can't plan in advance. What you have to have is the facilities local that can treat the people and treat the people quickly.
And finally, Mr. McGee, the Minister has praised all your hard work over the last couple of years. Your time in the post is coming to an end. Could you just tell us when you're finishing, and if there is someone else that is going to take on the role of Director General straight away?
So my tenure comes to an end at the end of October. I'd like to say it's been an honour and a privilege both living in Gibraltar and working in the GHA. It's been the best career it's been the best move of my career ever, and it's been a real privilege. We had literally today gone out to advert for my replacement, so that will be going international, and we're looking to try and attract the best candidate. I'm going to help in terms of if anybody wants any information, any candidates, phone up, and I will be singing the praises of Gibraltar and the GHA from the highest pulpit, because it's a fabulous country and it's a fabulous service.